Welcome back to Girls Only Hoops, Season 2. I am your host, Candace Allen. Please subscribe to our channel at Girls Only Hoops on YouTube, as well as follow us on all of our social media platforms, TikTok, Instagram, Twitter, at Girls Only Hoops, where you can find us, highlights, interviews, all of that good stuff. We have a very special episode today. We're going to be talking about the prevalence of knee injuries in girls and women's sports, especially in women's basketball. If anybody has been paying attention this year and over the years, you know that ACL tears amongst girls and women in basketball has just been a detrimental thing. We can go all the way back to Cheryl Miller. Her career ended even before the WNBA started because of an ACL tear. Some of the legends, Cheryl Swoops, Sue Bird, Candace Parker, Tamika Catchings, all have had to deal with ACL tears as well. And then, recently we've seen what has happened with the UConn women's basketball team, as well as TCU, and a whole host of numerous teams throughout the country where we've seen collegiate athletes as well as girls in high school playing basketball tear their ACLs or injure their knees and things of that nature. So we wanted to just talk about that today. We have a special guest, Alli King, who will be joining us a little later. But one of the things I did want to mention is that according to the National Library of Medicine, an ACL tear for women basketball players or female basketball players is 2.3 times higher than male basketball players. And according to the Yale Medicine Review, an ACL tear is more likely to happen in girl athletes from 2 to 8 times. So we're talking about an injury that is overwhelmingly affecting our girls and our young women. So we wanted to bring in our guest to give us some more input and some of her knowledge of just how we can encourage our girls to prepare for this injury, prepare if they were to get injured, as well as prepare themselves for any type of prevention, because it is a tough injury to come back from. It's not the end of the world. I've torn my ACL, was still able to play in high school and play effectively. However, it is something that we felt we needed to address. So please stay tuned after this break for Alli King, the physical therapist, to talk more about the prevalence of knee injuries in girls and women's basketball. And welcome back to Girls Only Hoops. We are now joined by the wonderful, one of our first guests, Alli King, physical therapist, doctor of physical therapy, joining us to talk a little bit more about knee injuries, the prevalence of knee injuries in women athletes and girl athletes. So welcome, Alli, to the show.
Thank you for having me.
Thank you. I appreciate it. And before we get into it and try to get all your expertise, can you just share with us a little bit about just your journey, just in sports in general? What sports did you play? How did you get into it? Some of your inspirations in that way.
So I started playing basketball when I was 6 and just fell in love with it. And I didn't really play anything else other than basketball. So I played it all the way up through high school. I did have a few injuries. I tore my ACLs in both knees. My right one was my freshman year of high school, and then my left one was my junior year. And unfortunately, my junior year, my second one was a little bit worse. So I've had my fair share of injuries. I didn't play in college, so I actually played here in Central Ohio at Reynoldsburg.
Oh,
so, yeah.
Okay. Yeah.
Yeah.
Okay. City kid. I appreciate that.
Yeah, already.
Did the injuries kind of lead you to a career in physical therapy?
Yep. After almost like a year basically being in PT altogether, I've always enjoyed health, and loved working out and exercise. And I used my injuries to kind of go into that field and stayed with it, and I absolutely love what I do. So I kind of took it as, I had a positive out of, some adversity when I was younger. So I think a lot of PTs have a personal experience with that too. So I just enjoyed the grind of PT.
And she's solidified too. So honestly,
Yeah.
like I said, she's a physical therapist. She does have a doctorate in physical therapy as well. So this is somebody who is knowledgeable about injuries, and as she said, has some history with knee injuries as well. And to make a little connection, I did tear my ACL as well in high school. Well, in high school, I believe I was in the 8th grade, but didn't get surgery into the 9th grade. So I know what it is to
Yeah.
be hurt. I
You
know
know
what
how
it
it
is,
goes. That grind,
yes,
that
to
mental.
be
Yeah.
out. And I think for me, it was not necessarily the grind back or even when I was fully healthy. It was that period out that did the most kind of damage, where you saw all your teammates and your friends kind of excelling and you're just rehabbing. And that was kind of the
Yeah.
hardest part for me. So, it led you to physical therapy. It led me over to the media side. So we're making these
Love it. Yeah.
connections just to educate our viewers, and hopefully a lot of younger players, high school players, their parents can watch this episode and hear from you just about, what this injury is, knee injuries in general, how they can prepare, prevent, and XYZ. So we'll get into it really quickly. Not really quickly, but we'll get into it. Could you describe what the ACL is and its function?
Yeah, so the formal name of it is called the anterior cruciate ligament. Okay. Um, and basically, it's two bundles, and a ligament specifically is something that connects bone to bone. So a lot of people think of tendons. Tendons are muscle to bone. So a ligament is providing stability. And its function is it prevents the tibia, so the lower shin bone. Actually, I have a little. So the lower shin bone here, okay, prevents it from going forward. Okay. It also prevents the lower shin bone from like turning inward. Okay. So that's its primary restraint. So that's basically what it is and what it does.
So what happens when it's injured? And I'm pretty sure there are other ways to injure it, but the biggest one obviously is when it tears. So what happens when that happens?
Yeah, so they grade it on different grades. So there's a grade 1, grade 2, and grade 3. A grade 3 is a full blown tear, and that's usually most of the time how it goes. There's some people that have partial tears, which can be a grade 2. And what happens is usually within the first 48 hours, it swells up. The athlete tends to feel it pop most of the time. But a lot of times it doesn't really swell up until the first 24 to 48 hours. So you might see some athletes actually walk off the court, depending on, if they did anything else.
Yeah.
So, it can tear off the bone, or it can actually tear in the middle where the blood supply isn't as great. And so then usually once it's gone, it's pretty much gone.
Right.
And people don't usually feel pain until after the swelling happens, just because those nerve endings are gone. It's just more of a shock.
Yeah. So, what, I don't want to get into this question now, but I have to. Why is this particular injury so common amongst girls and women athletes, and especially in a sport like basketball? We know it happens in soccer as well, but the sport in which we cover here at Girls Only Hoops is basketball. Why is it so prevalent amongst girls and women athletes?
Yeah. So I will say there's not a for sure answer. There's been tons of research, and we've come a long way with this, and it is starting to help in rehab. The first thing is that we're seeing it more now also because more girls and women are playing sports, which is excellent. There is some structural differences between us and men. So the first theory was the notch, the intercondylar notch, which is where the ACL travels through, might be a little bit smaller on females. But they have seen that also in males. So they did see that there was increased rate with, some tear if they had a smaller notch. The second thing was also hormonal. They saw that tendons had increased, or ligaments, had increased laxity at certain phases of the menstrual cycle. So during ovulatory phase and luteal phase. They haven't associated it to how many people have torn their ACL when they're in that phase. However,
Interesting.
so with increased estrogen, you can have increased laxity in your ligaments. The big thing that, everybody asks about the hips. So, the theory is that we have wider hips than males. It's more so that the ratio between our hip and like thigh angle is larger.
Okay.
Males have a bigger pelvis than we do, but the ratio is small. They're a little bit more square, a little bit more um, like I always kind of like a guitar, because
It's
kind of
narrow.
going, yeah, it gets narrow as we go down, where they're more like a box.
Got you.
So that's one theory too. But the biggest thing I think and that's what physical therapy we're studying in our research, is more the neuromuscular aspect. So for you, you're eighth grade, 13, kind of going through puberty. After puberty, they have found that actually the quads strength has increased, but the hamstring strength pre-puberty and post-puberty didn't increase in strength compared to the body weight from the pre-pubertal state, if that made sense.
Yeah.
So the quads got stronger, but the hamstrings have not when the bones have grown.
Mm-hmm.
So it makes us a little bit more quad dominant. So when we land and it's more stiff-legged, that hamstring is not pulling on that tibia to bring it back. So that ACL is taking on that force and it's more likely to shear.
Okay.
Whereas it's different for boys pre-puberty to after.
Right.
Their ratio is not as great.
Right.
With that. So that's another thing that we have kind of tested and doing some more research on. Also, another thing, they saw the same thing with our hips, our lateral hips on the outside of your hips that help prevent the knee from collapsing.
Okay.
That after puberty, they were not, compared to the body weight from pre-puberty, was not equal. So that if those are weak, then the knee is going to be more likely to bow in. Does that make sense?
Oh, absolutely. And then,
Yeah.
to take it just a bit further, once girls in high school, like you said, there was that phase where your quads, when we're developing our quads and our hamstrings may not be of the same strength. As, women athletes get to college and things like that, we've seen a prevalence there as well, is taking on a lot of weight, knowing that there's a difference between high school and college. You're lifting weights, you're doing more running. That's probably different. Could that lead to more stress and lead to more injuries as well?
Yeah, I think, the load from high school to college is definitely great. They're working out twice a day, 3 times a day in the summer. They're going from high school right into the summer and going into college. And their strength training. And I think the load from high school to college in terms of fatigue, like the game is faster. Most of the injuries happen with fatigue. You don't get your landing mechanics are different as you get tired. So I think the greater load taken on to those ligaments over a period of time can have an impact on why might you see it more in college versus high school.
Gotcha.
However, it does still happen in high school.
Right.
Yeah.
I'm gonna save that term, landing mechanics, because my non-physical therapy mind, just being around the game, I do remember it was a thing of how girls land compared to how boys can land and how that could be a thing. So I'm gonna save that to my prevention question. But I did want to ask, when treating, say for instance, there's a player that comes in, a young person in high school, she has an ACL tear. What would the treatment be and what would the recovery be?
So right off the bat, are you talking after surgery?
Yes.
Or right after a tear?
Yes. So
okay.
More than likely for you to answer that question, does a full tear, partial tear, you mentioned the grades, does it always lead to surgery?
Not necessarily. We call them copers and non-copers. So we have some patients that might tear their ACL, and they might not have a meniscus injury or MCL injury along with it. We put them through a series of tests and evaluation to see if their quad is still strong enough and their hamstrings are still strong enough to support the knee.
Okay.
Rather than surgery. So you can, however, with usually we see those copers, non-copers, they're not playing a competitive sport.
Got you.
Like that. So more than likely they're probably undergoing surgery. So after post-op, I'm getting them in here probably within a week of surgery. And the biggest thing is trying to get that quad back right away. So after surgery, after a trauma to the knee, the quad shuts down. You basically you don't know how to activate it. I'm sure, I don't know if you had that experience with you. Yeah. So we have to get that quad back, and we have to retrain basically the brain to fire again. I use Russian stimulation. I stim my patients probably all the way up until they got, at least, I'm more cautious. Until 80% of their other, within their other quad, just to make sure we're firing. So at the beginning, it's more about getting your motion back, getting the quad back, getting your gait back so that you're not walking with a limp, getting off the crutches. And then usually after 12 weeks, we can do a little bit more. Even after 8 weeks, we can do a little bit more balance training, squats, and all that. So they're at least with me for 12 weeks.
Okay.
After that, they're doing a little bit more functional sports stuff, maybe with athletic trainer, or they're checking in with me at maybe once every other week, or they're going to more of a functional rehab to more sports specific treatment.
So in terms of months, how long can an athlete expect to be out during recovery and treatment?
So it's usually for, acute PT, which would be me for 3 months. But they can be out of sport from 6 to 9 months.
Okay.
Obviously our college players, they have access to treatment unfortunately high school is not, at this time.
For sure.
They're not seeing me every day like the college athletes are. They have found that, I think I had a quote here that 9 months that their rate of re-injury reduced by 51% for every month that they were delayed until 9 months.
Okay.
So that's why I think you're seeing a lot of more professional athletes. They're not coming back for 9 months to a year.
Yeah.
Just so they're preventing not to retain.
Ensure that it's all taken care of. Yeah.
Yeah.
That makes
And the big
sense.
thing is getting the quad back in order for the landing mechanics for that knee to be stabilized is the biggest limiter there.
And so in the same instance of if a high schooler came in post-surgery, getting ready for treatment, how can they prepare for what that recovery is going to be like, maybe for the athlete and for their parent?
So I try within the first couple weeks to really educate both my athlete and their parents, that this is a grind. Some days are going to be better than others. You're going to have some days that are going to be, you're going to feel really good, and some days you're going to be not as great, maybe painful that day. But it should be a linear progression. I expect them to come in here and work like this is your practice. This is game time right here. Okay. There's going to be some days you're not going to like me. But then, I'll be your biggest cheerleader. So, it's just that this is, I think getting them in that mindset to compete with themselves and to compete against what I'm giving them to do. I think when we're in the sports, we're all pretty good competitors. So right. I think making that fun and, trying to set the expectations of what should happen, especially at home, and doing their stuff at home, because that's what's going to help them too.
Right.
I encourage actually my athletes to go to practice. I encourage them to be around their teammates. I'll tell them, like, you can schedule your PT sessions around, you know, your practice time with your coaches.
Mm-hmm.
And when you go to practice, do your home exercises. Get with the athletic trainer, tell them what I'm having you do. They can help you if you need it. I think being a part of the team is a big part of the mental part. So that's kind of what I, help them with prep. So I lay that out with the parents too. I'm expecting them to do this. This is where they should be at. Sometimes I'll have parents where they maybe push them a little bit too much and they're not supposed to be there at that point.
Mm-hmm.
So it's just, making sure that the athlete is, understanding of that too. So,
Yeah.
yeah.
Those are good. Those are really good.
Yeah.
But the big question, and I hope, when we put this out and our viewers see this, is
Mm-hmm.
what can athletes do, from the player to the coach to athletic trainers in high school to the parents? What can we prepare, especially for our girls coming into basketball, playing competitive basketball in high school? What can we do to prevent? I know we can't, there's no foolproof prevention, but what are some exercises, drills? You talked about quads, you talked about the landing. What can athletes do to do the best that they can to prevent this type of injury?
Yeah. I mean, I think, it starts to, I think we should be weightlifting, yeah, like 12, 13 years old.
Okay.
They should be learning how to squat. They should be learning how, to do maybe an RDL or deadlift for their hamstrings. So those, like we talked about, how they found with, pre-puberty to puberty,
Mm-hmm.
around that time they should be weightlifting.
Got you.
Okay.
Yeah.
So, a squat is your athletic stance. You need to be able to
So
do it.
true.
And you need to be able to do it underneath load. Okay. So I think as parents too, like, maybe getting them into with the strength coach if the school doesn't have it available. Also too, I think we're getting in, even when I was there, I only played basketball.
Right.
And I know as we got, higher, it was only like focused on basketball. I think multi-sport is important as
Facts.
well. It teaches you different motor planning for different positions and so it's different if you're going to play golf versus you're going to play basketball, or if you play softball, or if you run track. All those motor planning on how, move the body in different ways can help as well. So, weightlifting, multi-sport, I think getting the coaches aware of what they should be looking for when they land. If someone's landing stiff-legged on one leg, or flopping out of bounds kind of crazy, you need to teach them that, that you should be practicing that. Bringing in maybe a physical therapist or, athletic trainer to do screens on the girls and kind of show the coaches what to look for,
Okay.
even, young. So, it's, and also too about the coaching, like making it, external. So a lot of people, we've found on new research too, like people will tell you, don't bring your knee in, right? Doing drills in front of cones, like keep the knees in front of the cones, because it helps it be automatic for them, rather than telling them, don't put your knee in, to give them something to look at.
Right.
So I think getting all those people involved, I think the biggest thing is weight training early. Especially for girls and the guys too, but
Yeah.
just knowing that those muscles are not prepared is a big, I think would help.
Yeah. That's something that just didn't cross my mind. I would, coming in, I would think the opposite is just like maybe too much weight too early would be a negative thing, but it makes perfect sense if it's our quads that aren't, or if, there's some kind of unequal balance between the two,
Yeah.
our quads and our hamstrings, that we should be starting to strengthen those up early so it could
Yeah.
help prevent these kind of things. Have you seen, you know, with maybe shoes, sneakers, sometimes, we're doing a better job of making sneakers for women, or that are fitted for a woman's foot or a young girl's foot. Have you seen anything in regards to the type of shoes women or girls wear that can lead to these kind of injuries? Or is it mostly, like you said, the weight training, how we land, those kind of things?
Yeah, I mean, I'm not familiar with the shoes now compared to when I played, I'll admit. But the one thing about shoes, and even for my other athletes, if the shoe doesn't fit right, if it hurts anywhere, then it's not even with. There's no such thing of breaking them in.
Gotcha.
If it doesn't feel right, it doesn't feel right. So, finding the right shoe. A lot of my girls, they're flat foot. They have a flat foot, which actually can lead to that knee bowing in. So if you need an arch support, like orthotics would be good. So maybe getting into like a running company to get your foot screened, or seeing a physical therapist for recommendations on what shoe to wear. I don't think, from what I can recall, is no like exact research to linking footwear to ACL.
Mm-hmm.
However, they have seen if you have a flat arch when you land and the arch is not supported, it can lead to that knee bowing in.
Okay.
So looking for those athletes that do have that would help prevent that.
That's a good one too. I have flat feet, was an athlete. That was probably led to the thing, but not recognizing that even potentially having arch supports or getting your foot screened could help, not necessarily foolproof, but just
Right.
could help to prevent these kind of injuries. Is there anything else you would like to share for, we speak a lot about high school athletes, that they should know about just injuries in general, and what mentally they can do to get themselves together if they have to go through physical therapy, and or any just wisdom that you have that you would want to dispense to them?
I would say, speak up if it hurts. If you're really fatigued and you feel like I'm not going to put in the best effort with my landing mechanics, or just playing, speak up. Um, if I sometimes you just want to make sure you're not pushing through it just to push through it, and you're getting hurt
Yeah.
worse. So, I think you just make it. It's a hard one to say. If you are injured, it will get better. I think recommending maybe physical therapy or visiting with athletic trainer to see what's going on is a move in the right direction. Doesn't mean that if you're going to go see physical therapy that I'm pulling you out of the sport,
Yeah.
or that any physical therapist is telling you to sit. Because I think a lot of, I know I just wanted to play. It doesn't mean necessarily that I'm always telling you to sit. Just let's get it looked at and let's see what's going on. Or if you're concerned about something, I think that would be my biggest advice: is just speak up.
I like that. And that's very important. Well, thank you again for dispensing your wisdom to us and to our viewers regarding this. But before I let you go, I have to ask you some questions about, women's basketball, that whole thing. I asked you before we hopped on, women's college basketball is kind of your a sport you pay attention to. So I'm just going to give you two questions. So the first question is, how far do you think the OSU women's team is going to go this year?
Oh, I think they're going to go pretty far.
Okay.
I think at least Final Four.
Okay. We think the same.
I think they're, yeah, I mean, they look solid. The Iowa win impressed me,
Yeah.
especially with Caitlin Clark scoring 47 points, and they still pulled it out. So, I think my prediction is Final Four at least.
Final Four, same. I will tell on myself though, I did turn the TV off in the fourth quarter when they were making their comeback because I couldn't get myself together. Like I
Yeah.
was like sweating like I was in the game. I had to turn it off, but I turned it back on for overtime. So,
Yeah,
but
there
I
you
missed
go.
all the comeback. So you speak about the Final Four. Give me your 2024 women's college basketball Final Four teams.
Final Four teams.
Yes.
South Carolina, Ohio State.
Okay.
I think Iowa will be in there.
Okay.
Who, LSU just had a couple losses. I'm not quite throwing them in there. Ooh.
It's Utah, it's Colorado, USC.
Yeah, Colorado looked good.
Yeah.
They did. They were. I've kind of been rooting for them just because it's just
It's one
different.
of those teams that really never they never got the pub like, we normally have
Yeah.
the mainstays, and Colorado is one of these new ones.
Yeah, so I'm gonna go Colorado.
Colorado. So South Carolina, Ohio State, Iowa, Colorado.
Colorado.
I like that. I like that. Well, thank you so much, Alli, for joining us. This is
Yes.
Girls Only Hoops Season 2. We will see you Monday for a new episode. Thank you so much.